What are you doing? Stop. Come on, stop. Stop. What are you doing? Don't be crazy. Don't be crazy. No. What's up, guys? Oh my god, I miss you so much. I haven't talked to you in years. Oh my god, it has only been 24 hours and I feel I missed you guys. Hey listen, if you are new to the channel, oh my god, you're so lucky you came across my channel because this channel is the most lit, and I'm saying lit, nursing channel on YouTube. Our topic today is so dear to my heart, and I know some of you guys get scared when you hear the word bone marrow transplant or oncology or chemotherapy, but listen, I'm gonna make it simple for your Nclex test. Period. I want you to know that you are in good hands because Alpha Slice is here and Alpha Slice make it simple. But before we jump into today's topic, let's meet the family. Woo! Hey Nala. How you doing, Daddy?
Good.
What are you doing?
Playing games.
Oh my god. Oh my god, you're playing games? Who do we have here? Oh my god, and Manny. Hey, how you doing, honey? What are you doing? What are you doing? Hey, Judah.
Hi.
How are you, Daddy?
Good.
Just sleeping. It's time for you to sleep.
I'm tired.
You're tired? I know you had Dinah Day today. Was it fun?
Yeah.
Okay, good night.
Good night. There was a secret passage.
Hey, man. Hey, lady. Come closer a little bit. I want to talk to you. Focus. By this time, if you haven't subscribed to my channel yet, oh my god, you're not my friend. Because on this channel, we give you information that's so valuable. Everything you need to know about the American life. Everything you need to know about nursing. All the tips and tricks. And if you are preparing for your Nclex, oh my god, I promise you with an amazing series of Nclex made easy. Every topic on the planet, we're gonna talk about it and make it easy. I already made one video about EKG and people loved it. Today, we're gonna talk about bone marrow transplant. Don't be scared because I'm gonna explain it to you in a way that will stick in your head forever. If you have watched my Casey Neistat Called Me Out video, you would know that I talked about be the match. Be the match. Be the fucking match. By the way, we're giving a GoPro by the end of April, so if you haven't watched the Casey Neistat video, I would highly suggest that you go, follow the instructions, and enter the giveaway. But let's talk about Be the Match. Be the Match is a non-profit organization which enables you, me, and everyone in this community to donate bone marrow transplant and be able to save a life. Donating bone marrow to save a life is as noble as it can get. I registered and I got my buccal swab kit. I'm gonna do this in the next couple of days, but if you are encouraged and you want to save a life, check them out. I'm gonna leave a link down in the description box. But let's cut to the chase. Some of you guys might know, but I am a certified pediatric hematology oncology nurse and I've been certified since 2012. And I've worked in bone marrow transplant for 2 years. So I'm gonna share my experience with you and I'm gonna teach you all you need to know about bone marrow transplant for your Nclex in less than 10 minutes. But before we jump into that, one more thing, and I'm telling you, just one more thing, bear with me. Let's meet Angelina. Hey, Daddy. Hey, she just woke up. Oh my god, how you doing, Daddy? How you doing? I missed you today. I missed you. Alright guys, let's cut into the chase and jump into a top view. Alright guys, thank you for being here. So today we're going to talk about bone marrow transplant. And I don't want you guys to get confused, but when they talk about bone marrow transplant or stem cell transplant or even hematopoietic cell transplant, it all means the same thing. Alright, so the first thing you need to know about bone marrow transplant is the types of bone marrow transplant. There are 3 major types of bone marrow transplant. We're going to start with autologous, allogenic, and last but not least, you've got cord. And when I say cord, I mean umbilical cord. Alright, so first we're going to start with autologous bone marrow transplant. And from the name you would know what it means. Auto means self. So the patient donates his own bone marrow, then he will undergo chemotherapy plus or minus radiation to kill his tumor, and then you transplant back his bone marrow because his bone marrow is healthy. And let me give you an example about autologous bone marrow transplant. Some patients who have multiple myeloma or neuroblastoma, these guys, they have healthy bone marrow. So their bone marrow is healthy, but they have that type of cancer. So one of the treatment options is to take their healthy bone marrow, reserve it in a blood bank, and then give intensive chemotherapy, radiation therapy, whatever it takes to kill the tumor. At the same time, you will be killing his own bone marrow. And then when the patient finishes his protocol and his immunity is down to 0, then you rescue him with his healthy bone marrow and you transplant the patient. This is the time when you use autologous bone marrow to treat a patient. Now we're going to talk about cord blood transplant. And when I say cord, I mean umbilical cord. So umbilical cord transplant is pretty simple. It explains itself. You've got a pregnant woman, and then when she is 9 months and she's about to deliver in the delivery room, cord blood will be collected in special tubing and stored in the cord blood bank. And then if there is a patient in need for bone marrow transplant and he does not have a donor, then that is an option to have cord blood transplant. They will go to the cord blood bank, find him a unit, and then transplant him. So if we want to wrap it up, umbilical cord blood transplant comes from a pregnant woman. After 9 months, she delivers, they collect the cord blood, and then they store it in the cord blood bank. Once it's needed, it will be given to the proper patients. Period. Now we're going to talk about the allogenic stem cell transplant. So the allogenic stem cell transplant is actually divided into 2 forms. So the donor could be a related donor or could be an unrelated donor. If the donor is related, then that will increase the chances of successful bone marrow transplant, and it will decrease side effects. And the unrelated donor would be the opposite to the related donor. It will have less chances of successful BMT and more side effects. So the related donor is also split into 2 options, and the unrelated donor is split into 2 options. So a matched donor, unmatched donor, matched, unmatched. So what do we mean by matched donor and unmatched donor? There's something called HLA, which is human leukocyte antigen. There are 6 HLAs in a human cell. So for a donor to be fully matched, the 6 HLAs from the recipient should be compatible with the 6 HLAs from the donor. Once you have that equation, then that's the perfect match. You can also have 6 out of 6 HLAs as an unrelated fully matched donor. But a related full matched donor is more favorable than unrelated fully matched donor. I'm not that good in drawings, but to explain HLA more, this is the cell. The HLA is the encode cell surface marker, and there is 6 of them. So the unmatched donor is someone who has 5 of 6 HLAs. And again, a related unmatched donor is way more favorable than unrelated unmatched donor. So now we're going to talk about the procedure of donating bone marrow. So the procedure is actually pretty simple. It could be done with pain mats or sedation, which is conscious sedation, or with no pain mats nor sedation. The physician will use lidocaine to numb the area. Usually they position the patient on the side or belly and aspirate the bone marrow from the iliac crest. If the patient is autologous, then they will take the bone marrow before starting treatment, and they will store it. This is usually done 2 weeks to 4 weeks in advance. If the patient is for allogenic bone marrow transplant, then the marrow is donated on the same day of the transplant or the day before, just to keep it fresh. So what is the pre-op patient education? First, if the patient is taking any anticoagulation, he needs to stop it. Explain the procedure to the patient. If the patient is going to be sedated, then you're going to tell the patient to be NPO for at least 8 hours for food and 4 hours for water. And because this procedure is done as an outpatient, then if the patient is receiving sedation, you would need him to have a driver. Post-procedure education, you're gonna tell the patient about his dressing. It needs to stay dry and clean. Patient can take a shower 24 hours after the procedure. Patient can take pain medication if he's in pain, and some doctors prescribe iron for 1 month and a repeat CBC after 1 month. Some of the candidates for bone marrow transplant, and you don't need to memorize that, but I'm just gonna give you examples just for you to have an idea what kind of cases are selected for bone marrow transplant. So some of the cases are leukemia, lymphoma, multiple myeloma, sickle cell disease, Fanconi anemia, aplastic anemia, neuroblastoma, and Willem's tumor. There's much more, but I just want to give you an idea idea. If you don't know anything about these diseases, it would be a good idea if you Google them and read the definition. Alright, so the million-dollar question is, how do we transplant patients? Some might think that it is done in the operating room, same as a lung transplant or a liver transplant, but no, it's not the case. The act itself to transfuse stem cell to a patient is as simple as transfusing a unit of packed RBCs or a unit of platelets. The only difference would be in a stem cell transfusion, you use sterile technique. So you actually put a sterile drape, use sterile gloves, and all that good stuff. So now you know. Usually a patient who wants to undergo a bone marrow transplant, they are admitted to a special unit called the bone marrow transplant unit. The process is usually a month long. Usually the patients are admitted 7 to 11 days before the transplant day. And the transplant day, we refer to it as day 0. Anything before that, we refer to it in the negative. So you start negative 11, negative 10 days, negative 9 days, negative 8 days, and so forth. So before the transplant day, the patient receives intensive chemotherapy plus or minus radiation therapy. Usually it is total body irradiation. A very important day on the timeline is day -3. Because on day -3, the patient is started on prophylactic antiviral, which is acyclovir, and CSA, which is cyclosporin. Cyclosporin is an immunosuppressant. And the reason the patient is taking CSA or immunosuppressant is because on day 0, the patient is going to receive foreign cells. And one of the side effects is that the patient's own cells will reject the donor cells. And that will cause something called GVHD, which is graft versus host disease. Alright, for cyclosporin, there are a few things you need to check. You need to check creatinine, and you need to check CSA level and adjust accordingly. Some of the side effects of CSA are hypertension and rash. Day 0 is the transplant day. Simple procedure where the patient will receive his stem cells. Then after day 0, we'll start counting as day +1, day +2, day +3, and so forth. So the major things we do before the transplant day is that we give intensive chemotherapy where we kill every single rapidly growing cell in the patient's body. Some of the rapidly growing cells are hair follicles, mucous membranes, and bone marrow cells, as platelets, RBCs, and white blood cells. Our aim is to empty the bone marrow and drop the ANC to 0. Usually if the platelet count is less than 20,000, we transfuse the patient, and if the hemoglobin is less than 8, we transfuse the patient. One of the major side effects with intensive chemotherapy and radiation therapy is TLS, which is tumor lysis syndrome. So what is tumor lysis syndrome? Tumor lysis syndrome is actually when all the cells are destructed, and then whatever is inside the cell will go out into the bloodstream. So potassium is usually intracellular, and when the cell is destructed, potassium will go into the bloodstream, and that will cause hyperkalemia. Hyperphosphatemia is another electrolyte imbalance, hyperuricemia, and hypocalcemia. Alright, so actually this stopped recording right here because I was out of space in my memory card. But anyways, side effects for radiation and TBI could be headaches, confusion, short-term memory loss, skin reactions, and rash. So what do we monitor after day 0? We wait. You're gonna ask me, we wait for what? We're gonna wait for the ANC to pick up. Remember, our target was to get ANC to 0. Then after the transplant on day 0, we will do CBC on a daily basis to monitor the ANC. Usually the ANC picks up after 2 to 4 weeks. During that time, we monitor side effects for the immunosuppression that we caused the patient. The first sign for an infection would be fever. Usually the provider will start with cifepime and gentamicin at the same time. After 48 hours, if the patient is still febrile, they add vancomycin to cover everything. Bear in mind the patient is already on acyclovir, which is antiviral. But after a day or 2, if the patient is still febrile, you add some sort of antifungal. Some of the most popular antifungals in bone marrow transplant are amphotericin B and Duflacon. During that time, we're also giving CSA, and we give GCSF, granulocyte colony stimulating factor. Here in the States, they might give Neulasta. When the ANC picks up and it's greater than 500, then you start the plan for discharge. So basically, this is all you need to know about bone marrow transplant in regards to your Nclex studies. If you have any questions or you need clarifications about any point, please do not hesitate to drop a comment down below. And if you like this video, please do not hesitate to smash that like button. And if you are new to the channel and you haven't subscribed yet, please do me a favor, punch that face down below to subscribe. And if you haven't watched yesterday's vlog, Click over there to watch it. Until next time, be an alpha slice.
21, 22, 23, 24, 25, 26, 27.